And welcome into To Your Health. And one of the big health issues in our country is mental health. May is Mental Health Awareness Month. And in the state of Alabama, we're fortunate to have a wonderful Department of Mental Health headed up by Commissioner Boswell. So good to have you with us again. You
Thanks
doing well?
for the invitation. I'm doing well.
Absolutely.
Taking care of my mental health.
Taking care of your, no, we all have to do that.
We do.
And were there any special things that were addressed during Mental Health Awareness Month?
You know, the focus this year was really on being connected and how important that is to your overall mental health. More days together is the theme for mental health on a national level. And so we talked a lot about how important it is to be connected to your community, connected to other people, and what a positive impact that has on your overall mental health.
Yeah, I know, because basically more days together means more time you're spending away from just being alone.
Right.
And I guess loneliness is the biggest problem, isn't it?
It's a huge problem in the United States. It's certainly a problem in Alabama. So many people are disconnected from their community. And of course, COVID didn't help that. You know, we still talk about the impact of COVID and people really disengaging in community. And really, isolation is the worst thing you can do for your mental health. And so we really do encourage people to reach out to folks, especially if they know someone who is maybe isolated at home. Really reach out to them and connect with them, because that really will improve your overall mental health and their mental health.
And I think one of the worst things we've done, the good news, the bad news, the good news, you have a phone, a cell phone. The bad news, that's it.
Right.
Your whole life is in that phone.
That's true. And, you know, a lot more information is out there today about the negative impact of phones on kids. What we don't talk a lot about is adults who are looking at their phone instead of being engaged with family members, or instead of going out in the community and being engaged. And so as adults, it really is an issue for us as well. And really remembering to put down the phone and connect and make eye contact is huge.
I'm smiling because going to a lot of restaurants,
you're
sitting at look over at that table, there's 4 people there, and they're all like this.
Yeah.
So, well, why did we come to dinner? That used to be the most conversational time in a family's life. And it was a good time to, as you say, connect.
Right.
You know?
Yeah, we even have to do it in meetings. Probably about 5 years ago in our meetings, we put a little symbol that basically said no phones.
Nice.
And it took people a while to get used to not looking at their phone every few minutes. But the meetings are to engage and problem solve, and you can't do that if you're looking at your phone. So.
Yeah, and one of the things with my phone, a lot of times I'll go somewhere and I'll leave it in the car. If I'm going into a meeting, and this way it's not a distraction in any way, shape, or form.
Right.
And of course, older people now, that's becoming their source of everything.
Right.
Which is crazy.
Right. Yeah, that again, you know, not reaching out to community or not being engaged, it really is, it has its pluses and its minuses. You have ready access to very valuable information for sure, but you don't want to have that be your only connectedness to your community.
And about 2 years ago, the legislature passed something about no cell phones in school.
Right.
Wonderful.
Yes.
You know, because then teachers have said, what an improvement.
It's amazing. The positive feedback we had from teachers about the improvement in the classroom, the decrease even in the number of incidences of people meeting up in the bathroom, you know, to do things they didn't need to do. They weren't able to communicate with each other, so they couldn't meet up in the bathroom and do those things that can get them kicked out of school. And so the positive impact, the feedback about that legislation has been really, really phenomenal. And then, of course, the added benefit of improvement in learning and education is just something that, you know, when you think about all the legislation that's passed, I really do commend Governor Ivey and the legislature for that piece of legislation, because it made such a difference for kids.
Well, and then texting and bullying, which becomes a mental health issue.
Right.
Because the bullying, it's all going into here, isn't it?
It is, and people, kids can be really traumatized by that.
Well, and kids can be terrible for doing it.
Right, right.
I think both ends you're going to get the mental illness is from the
Right.
bullying portion of it, and then they can affect a person mentally.
Absolutely. And, school systems, it's so hard. Teachers have such a challenging job. And I think,
They do.
it's
Yes.
like that, taking those phones away, I don't know that they anticipated the positive outcomes like bullying and some of the other things, but really trying to create that culture of learning in that classroom is already a challenge. They don't need anything else creating a bigger challenge for them.
But just think about it. It's 8 hours of rest,
Right.
if you get right down to it, because this is not a restful thing
It is
when
not.
you're doing that. That's
It is
good.
not.
Well, thanks for the good work you're doing. If
Sure.
people have any needs that they have, is there a website you can go to?
Certainly. You can reach us at mh.alabama.gov. And then if you need access to care, you can dial 988.
988. And that's for the And we're going to next segment. We want to talk a little bit about more of that.
Wonderful.
Okay.
Thank you.
Thank you so much, and we'll be right back right after this.